Thank you, Mr. President. Thank you for recognizing me, and I'd like to talk a little bit on the floor about an issue that's cascading across the country and is deeply troubling in the state of West Virginia, the region in which I live, and that is the opioid crisis that we're seeing. Many of you have recently read about what's happened in the city of West Virginia, of Huntington, West Virginia. Huntington's a beautiful city. It sits right on the river, Ohio River, at the corner of West Virginia, Kentucky, and Ohio. It's the home of the Thundering Herd, Marshall University. However, 1 month ago today, on Monday, August 15th, in just a 4-hour period, this small city of Huntington was the site of 28 overdoses. Responding to this mass overdose occupied all of the ambulances in the city and more than a shift's work of the police officers in Huntington. Of the 28 people affected, 26 were revived using naloxone, a life-saving drug that helps reverse overdoses. However, the heroin that they had used was likely laced with a substance so potent that the ordinary dose of naloxone wasn't enough. Responders had to use 2 and sometimes 3 doses of naloxone to bring people back to life and out of the overdose. Rashes of overdoses due to particularly strong batches of heroin have been happening more and more frequently. This is heroin that's likely laced with fentanyl or a new product we've heard about, synthetic product called carfentanil, which is a drug used to sedate elephants, of all things, and other large animals that is 100 times as potent as fentanyl. And the outcomes are and apparently this is happening much too frequently. Versions of this chaotic scene are happening day after day in big cities and small towns in Kentucky, New Hampshire, Ohio, and Florida, the region and area of my friend Senator Portman's state of Ohio in Cincinnati. I think probably 2 or 3 days after this occurred in Huntington had the same thing, but much larger. But what makes the recent spate of overdoses in Huntington so noteworthy is that Huntington is a city that knows it has a problem and is doing all of the right things to fight it. They've really worked hard to put together, under the mayor's guidance, a great consortium. In 2014, it began to fight this scourge on their town. The mayor started the Office of Drug Control Policy. They have staffed the office with people who have intimate knowledge of the problem. They're not hiding their head in the sand. They're not saying it's something else. They know what this problem is, and they're trying to hit it face on. So staffing the office, they have a former police chief, a fire department captain who is also a registered nurse and works at the hospital, a police department criminal intelligence analyst. They've created a strategic plan which focuses on 3 general principles: prevention, treatment, and law enforcement. The plan embraces harm reduction strategies, including weekly training for citizens on how to use naloxone. I actually went to a naloxone training seminar myself just to see, and it's really, if you're trained on it properly, it can make the difference. And it can make the difference in preventing people from inflicting irreversible damage to themselves and others. Huntington has expanded their adult drug court and recently received a grant to launch the Women's Empowerment and Addiction Recovery Program, a specialized track within the drug court that will expand services to address the needs of drug-addicted prostitutes. And even in the face of the overdose, they are making progress. In fact, cooperation among local agencies, the cooperation and the sad reality that they are well-practiced and well-trained can also be accredited with the 26 lives that they have saved. And while the overdose rate in Huntington has remained steadily high, the number of deaths from overdose has fallen, and that's an encouraging sign. Jim Johnson, who's the director of the Huntington Mayor's Office of Drug Control Policy, has said, and I quote, "What we are seeing around the country is overdose deaths going up, especially with the rise of fentanyl and other substances. It's not good that our Huntington overdose rate is holding, but compared to others who are having real increases, it's encouraging, and we are happy that the death rate has come down," end quote. As I've heard from West Virginians, and read local and national news accounts about this rash of overdoses, I think, what have we done and what do we need to do to help cities all across this nation? The Comprehensive Addiction and Recovery Act, CARA, marked a big first step forward. It reflects some of the best practices we've seen in places like Huntington. It includes reforms to help law enforcement respond to this epidemic, such as the successful drug court programs that operate in West Virginia and many other states. It expands the availability of naloxone and allows funds to be used for follow-up services for those who receive another chance at life. I mean, when somebody comes into the emergency room in an overdose situation, is administered naloxone, and then, an hour or two later gets up and just walks out the door, we haven't really followed through on our public health obligation. So in this bill, we've got follow-up services so that person can be followed by a home visit or a home phone call to see what their situation might be. I proudly voted for CARA, as most of us did, and believe it is an excellent first step, but that's exactly what it is, a first step. Now we must take a fresh look at this epidemic. An epidemic that, to me, is threatening to take an entire generation, this next generation of our best and brightest. We must look at ways to stop the drugs from getting to our communities. One solution is the Synthetics Trafficking and Overdose Prevention, or the STOP Act, which was recently introduced by Senators Portman, Ayotte, and Johnson. The STOP Act, which I recently became a co-sponsor of, is designed to stop dangerous synthetic drugs like the fentanyl and the carfentanil that I talked about from being shipped in through our borders and address any gaps in our mail security. Earlier this year, I announced that the DEA had established a tactical diversion squad in Clarksburg, West Virginia. Probably doesn't sound like much, but it'll be a big help to enhancing our law enforcement efforts to stay one step ahead of this influx of drugs. Programs like the High Intensity Drug Trafficking Area Program, known as HIDA. These programs are critical in helping to coordinate initiatives that reduce drug use and abuse in communities. We must embrace and intensify prevention strategies in our schools, community centers, and our after-school programs. Our youth cannot think that this epidemic is acceptable or that it is the new normal. We must ensure that when someone decides they want treatment for their drug use, they have access to this treatment. We hear story after story of the lists of people. There's no lists of people to admit into a incarceration. There's no waiting list here. Yet there's a waiting list for our drug treatment and prevention centers. September is National Alcohol and Drug Addiction Recovery Month. And today, Senator Murphy of Connecticut and I are offering a resolution which honors the significant achievements of those citizens who are now in recovery. The resolution also recognizes the nationwide need for increased access to treatment. This is an area where we have so much more work to be done. We must have the detox beds available and the workforce trained and ready to assist those seeking treatment. We must also make sure that we have a range of treatment options that are available. This is definitely not a one-size-fits-all kind of a problem. Each addict found their way to addiction in a different way, and each must figure their own path out, whether through inpatient rehab, peer-to-peer rehab, medication-assisted therapy, a 12-step program, or most likely, a combination of these and other options. It is also essential that we remember that recovery does not end when an addict finishes treatment. Services need to be available to assist with their transition back into society. And we must look at the collateral effects substance abuse has on our communities, whether it's through increased violent crime, child neglect, and abuse or disease, especially hepatitis and HIV, given the rise in heroin use. Are there immediate solutions for all of these problems? No, we found there aren't. But like the city of Huntington, we must continue to come to terms with the extent of the problem in order to know what the solutions do make sense. And like Huntington, Progress is going to be incremental, it's going to take time. We can begin to tackle some of the problems through common sense changes in policies. One example is Jesse's Law, a bill named after a West Virginian. She was a daughter, a sister, and an addict in recovery. Following surgery from a running injury, despite her best efforts and those of her family, Jessie was discharged from the hospital. She had told the hospital that she had addiction issues. She was discharged from the hospital with a prescription of 50 oxycodone pills and later that evening, fatally overdosed. By amending the privacy regulations for persons with substance abuse orders, we can ensure that those individuals receive the safe, effective, coordinated care that they need and prevent other tragedies like Jessie's and her family's from occurring. I recognize that these problems are also going to take additional funding. As a member of the Appropriations Committee, like the President of the Senate, we work together. I've worked to ensure that these resources are going to programs that best meet a state's needs, whether it's HIDA, the DOD's counter-drug program, or substance abuse grants. In the fiscal year 17 labor HHS appropriation bill, there's a $126 million increase for programs fighting opioid abuse. In bills passed by the committee, funding to address heroin opioid abuse is more than double than last year's levels. However, I also know that this problem cannot be solved by simply throwing money at it. I look forward to working with my colleagues on both sides of the aisle to develop additional policies to tackle these problems. We must consider all options. The outcomes are sad. I mean, I personally know families who've been personally affected by this. I think everybody does. If you're in a town hall meeting and you ask a show of hands, who has a story, who knows somebody, who's from their church, their children's friends, almost every hand in the meeting will go up. We need to work with state and local officials to learn what's working and what is not. And I will keep fighting also for an additional issue, a side issue, and just as important are our veterans who rely on the VA programs to help with their opioid addiction. Or that newborn who's born dependent on opioids, the addict who's willing to seek treatment, and any other person, because every person practically in this country's life is touched by this disease. I will keep fighting for cities like Huntington, who even in their darkest hours continue to move forward and fight every day to a brighter, drug-free future. Thank you, and I yield the floor.